welcome to the second episode of part of the Impact Series. My name's Charlie Webster and I'm going to be your host throughout this. Across the Impact Series, we'll be speaking to a range of incredible individuals, both known and unknown, who have all contributed firsthand towards the fight against malaria and whose contributions have impacted people's lives and important research, both directly and indirectly. These contributions include new scientific advances, tools, policies, funding, level awareness, and of course, voices. Our aim is to highlight the work and the people who are working across affected countries, in addition to the values we hold dear, the speed of response, delivering with precision and responsibility, as well as our focus on positively impacting others. Now, in today's episode, we have the great privilege of speaking with Dr. Willis Akhwale. As a medical doctor by profession, Dr. Akhwale has more than 25 years of health management and technical experience, and is currently acting as the senior advisor of the African Leaders Malaria Alliance. Welcome to the Impact Series, Dr. Akhwale.
Thank you. Thank you very much. It's my pleasure. I feel also very, very privileged to be among those people selected to be on this Impact Series. My appreciation.
Well, thank you, Dr. Akhwale. I think hearing your voice is going to be so important, and your story throughout. I think a really good place to start is, how are things at the moment on the ground in Kenya in terms of malaria?
We had made very good progress in terms of malaria in this country. We had started seeing a reduction in terms of the number of cases. There was an 8% reduction in overall prevalence, and we had also started seeing a reduced number of admissions. However, as you know, the COVID-19 pandemic has had an impact on access to the intervention.
What inspired you and motivated you to get into the field of malaria? Because you've had such a huge impact.
Yeah, I would want to start saying I think life is absolutely interesting. I may have just been destined for this. When I was about 10 years old, I was in my primary school here in Kenya. And like very many families, during the Christmas holiday, we traveled to the rural areas. My original home, or my roots, are actually in Western Kenya, very close to the Ugandan border, around the Lake Victoria region. This is an area with a very high malaria burden. It is perennial. That means there's transmission throughout the year. So on my way back to Nairobi, we arrived and I started seeing illusions. This disappeared for a moment. And when we reached my home, I found I had a very high fever. I was very sick, and my father recognized I'm sick. But by evening, I was totally disillusioned. I didn't want to eat food. I was vomiting. I was seeing objects that were not there. People could not understand. And we had a neighbor who was an old nurse who immediately realized this is somebody who needs to get admitted and be treated. So I was then quickly taken to the hospital and put on intravenous management. From that evening, the next morning is when it's like when I gained my consciousness, I saw a complete new world. It's not anything I had the previous day. That to me, I know the diagnosis was cerebral malaria, one of the major complications of malaria and a real killer. I survived that, and I think then that is when my destiny to the field of malaria started.
So over that time, you obviously went from, you recovered as a 10-year-old and that changed your life and inspired you to work in this area, especially being from a place which is so affected by malaria. How did you then get into your field?
Yeah, so as I went through secondary school, I had a lot of interest in biology, the science, also developed interest in chemistry, just developed really reading what people did in the field of medicine. And it always inspired me that really through efforts, you can always get solutions to a lot of the challenges that we have. And really through my secondary school, it was the sciences, it's the biology, the chemistry that really used to make me excel. It was very clear I wanted to be a doctor. It used to be very competitive. I was almost discouraged. I was told this is so competitive, they only take 100 admissions per year. That time in Kenya, only between 100 and 105. How sure are you you'll be among the top? I said, well, let me have it as my first choice. If I can't, then I'll do something else. I did my advanced level high school, and I passed, and I was admitted to the University of Nairobi, where I did my medical education.
So in terms of where you are now, could you tell us more about your role right now, especially as the head of Division of Malaria Control in the Ministry of Health and the head of Department of Disease Prevention and Control in the Ministry of Public Health? You have a really prolific role. Can you tell us more about what that is on a day-to-day basis?
Yeah, Charlie, before I answer that, let me just also give us another small background that once I graduated, I was posted to an area a little bit far from where I come from in Western Kenya. Right. And I was like in charge of the medical services in that locality that happened to be then a district in Kenya. And at one time, there was a major outbreak of what people did not know. They thought this could be meningitis, could be typhoid. In the end, it ended up being malaria. And what I really saw were those, within a lot of homesteads, there were absolutely very many sick people. And then, in fact, the admissions were very high. And at the same time, immediately after that outbreak, in another county not very far from where mine was, a similar outbreak occurred, and it was much more severe. So I was requested to go and now work from that county to take my experience on prevention. And unfortunately, the severity there was beyond human understanding. In 6 weeks, over 600 people died. So during that time, among the people who were supporting the efforts, there were the Japanese who brought support to just try and ensure this treatment. And in the process, as we worked with them, they told me, why don't you come over to Japan, and we are able to do some analysis to find out why this malaria was so severe. And that gave me the first opportunity into the research of malaria. Here it is referred to as highland malaria. Basically, it gets populations that have no immunity. Right. So here was a highland area in Western Kenya, and that's what my thesis really was all about. We looked at the immunity of people. We realized how even the adults were dying. It was now not just the children dying. That really was my entry point into now the whole issue of malaria research and malaria program.
What was it like? What was it like having that opportunity and studying in Japan?
Oh, it was very, very exciting. The good thing, many people say, oh, did you learn Japanese? Actually, we went into a laboratory that had very many other people, some from Africa, some from Europe, some even from America. Among my mentors, my second supervisor was from the US. And the laboratory had people looking at the malaria vector, those looking at the parasite. We made an assessment. It gave me an opportunity to go to other parts of Africa. Mm. And we were all looking at this malaria parasite. What is it all about? What is the resistance? That time there was the resistance to the treatment that was being used then, sulfadoxypyrimethamine. So I think the exposure to other people very interested in malaria, working with academic institutions, both in Europe and the US, who are all looking at malaria, really made me feel like, yes, I'm reaching at the top of my career. And so when I came back to Kenya, immediately I presented my thesis and everything. They told me, we are posting you to the National Malaria Program. We want you to be in charge of case management and operational research. And at that time, there was the challenge of the resistance to the medicines that were being used. and I was to consolidate data that would guide in policy making. It was a very, very exciting but very difficult task that I had. We had to get data from research institutions, individual researchers, package it and say, yes, we have evidence that we have resistance. That was my real baptism into what now I want to call malaria program. And after a very successful period there, we were able to change the policy for malaria treatment from the then medicines to the more efficacious medicines of artemisinin combination therapy. I was among the very first one to evaluate their effectiveness in populations here in Kenya. And soon after that, I was then appointed as the manager for the National Malaria Program in Kenya.
And how have things changed for you over that period of time? And what have you seen in the changes with the way malaria is approached?
For me, I started looking at what impact can I have at the community? And two aspects of malaria come now. The program, which means ensuring the interventions reach the people, how organized policy are translated. And then secondly, it is how we learn from what we are doing to make it better. So, so during that period, I got a lot more excited to see how better we can reach communities. And I got excited when, for example, when we had done a change in policy, the dissemination of the policy, reaching the community, capacity building the healthcare workers. And when that now happened, the whole idea of implementing, what are we learning to ensure that we reach? So for me, when I started seeing more people are using the bed nets, mothers are ensuring that their children are promptly treated, community health workers have been empowered to make an assessment of the children who are sick, and that then there's an increased access to effective malaria interventions, and that I can be able to write about that. That excited me. In fact, one of my earliest publications, therefore, was the challenges of policy change, malaria policy change in Kenya. And from that time then, I started moving more towards the implementation science than actually just the high-level research science in malaria.
Because it's interesting, because you've got the high-level research, which you were talking about, the laboratory side of it. Then you've got the kind of global funding side of it. Then you've got the global macro government side of it. And then you've got the localization. How important, Dr. Akhwale, is understanding the geography, culture, community of Kenya and places where malaria policy is implemented?
Yeah, so one of my earlier supervisors had done a thesis on control of malaria in the Pacific, Vanuatu in particular. And he always used to emphasize that malaria can never be eliminated without the involvement of communities. You will do as much as you can. The cases may go down, they will always come back again if communities are not involved. So for me, that became my principle, that in everything that we are doing, what is the position of the community? How involved are they? Do they know that this is their problem? Do they know that the burden is theirs, not because a paper has been presented in a major conference somewhere? They themselves, do they also appreciate that the number of deaths within the communities are high, and that the interventions that are being put there could be just what saves them? So that is how I really looked at it, but also appreciated that the world must learn from the efforts that we do in Kenya. And therefore, just having abstracts, really going out there, I will not talk about the high level things, but those simple things, process the issues. I think, to me, that I feel more satisfied that is the area I really moved into.
How important, Dr. Akhwale, is local innovation in terms of diagnostics?
Yeah, so that is an absolutely important question that you've asked, because for me, diagnosis is the real entry to prevention. There are many other diseases that cause fever that will make children sick. If you have to know the true burden of what you are dealing with, then you have to diagnose malaria. And obviously, the laboratory has its challenges because one requires microscopes, it requires glassware, it requires trained personnel. It becomes a bit of a challenge to increase access to that. But we know it is the gold, it is the gold standard for diagnosis. So the issue of rapid malaria test kits that later on became available was a game changer, because we could now have diagnosis at the lower health facility level, including the communities. And that started giving us a better understanding on the burden of malaria. It also started giving confidence to communities so that you don't just guess a child is having malaria, but you can tell the mother, I have assessed the blood and this child has malaria.
Yes, so incredibly important. And from there, I'd love to talk to you about the vaccine as well, because in October 2021, the World Health Organization, they approved the vaccine for children at risk, which was really considered groundbreaking. I remember seeing it myself and thinking, wow, how much that's going to change things. And you oversaw the trials of the vaccine in Kenya. Could you tell us more about, well, your involvement and then the impact that it's having?
Yeah, so let me say about the early 2000, there was one of these big conferences on malaria. They are known as the MIM conferences. I think Multinational Initiative on Malaria. And it was held in Cameroon in 2005. And I remember one of the keynote speakers saying that we are not going to see a malaria vaccine in our lifetime. Everybody in this conference hall will be dead before we see a malaria vaccine deployed. And he gave the reasons of how complicated the malaria parasite is, and especially the stages through the human body and within the mosquito vector. So it seemed like a dream that really, I myself thought, I was young then, I thought, well, this has been said by the top people. However, towards the year 2008, we heard that there was some trials of a vaccine, and that Kenya would be among the countries where this trial would be taking place. The initial trials, I was not involved, but in the third stage, I was among the supervisors of that trial in one of the regions in Kenya. I wasn't really one of the main investigators, but by then, because of my work at the Ministry of Health, I had to supervise as the vaccine was being evaluated. And the results came out and they were exciting, with a protection level of about 39%, which nobody expected, because this really being the very first one, that was good enough. And then there was now a decision to pilot it. During that time, actually, I had left now working for the Ministry of Health. I had joined the University of Washington in Seattle, but based in Nairobi. And the Global Alliance for Vaccine Initiative approached me to be one of the reviewers on what the design would have been on the piloting of the malaria vaccine. And the big question I had to answer is how quickly we will then move from just being a pilot to a kind of deployment, so that it's not really research, given that it had some benefit. And based on my experience in what you call a translation from policy to program or implementation, I happily did my inputs. And I'm so happy because then the kind of structure that I advised, in which you needed to make sure that the folks working in the vaccine program and the malaria program work together so that they own the results of the piloting. So I'm happy that Kenya, Ghana, and Malawi, where it was piloted, and a follow-up of almost 18 months, the results remain encouraging. And I think WHO has approved now this vaccine. It's recommended it to be among other interventions. And from where I sit, I would say there's no silver bullet in malaria. We need to ensure that all these interventions are made available, especially in areas which have a high burden of malaria.
I know you said there's no silver bullet. And I think, like, just even from what I've learned over the years around malaria and my involvement, it takes so many pieces to make a whole, to be able to make a difference and eradicate malaria. But it's fascinating that for you as a younger man, that you heard somebody at a top level say, we'll all be dead, not in my lifetime will we see a vaccine, and there is. Like, Dr. Akhwale, how does that make you feel? And also, how much hope does that give in terms of our advancement?
I think here in Kenya, we have one of the top marathoners, and he actually ran the marathon in less than 2 hours. And at the end of it, he said, no human is limited. I strongly, therefore, want to say, even in the area of science, innovation, and technology, humans are not limited. And it is a matter of just facilitating. I think what is important is facilitating the young scientists, the people with the knowledge and skills, motivating them, really understanding what their role will play. If that then happens, I think a lot of solutions can be obtained across the globe, and especially for diseases like malaria, which you see where we sit here, we know malaria has been eliminated in a number of regions. And the question the policymakers, the high-level policymakers always ask, if other countries eliminated them, why not us here in Africa?
In terms of eradication then, do you think that we can eradicate malaria? Because I know that there's these dates put on it. So the global experts believe that malaria could be eradicated by 2050. And I know that since my own knowledge and my own involvement in the fight against malaria, the date moves. Do you think, one, it's important to put a date on it so that there's a goal? And do you really feel that we will achieve that?
I think putting a date on it is important in terms of advocacy, in terms of buying political leadership, government ownership in the fight, because then you start holding the government accountable to ensure that that happens. But from the programmatic scientific, I think we also need to be honest that challenges could become bigger, but that then it will give us a better opportunity to see how best to approach those challenges. And two things come to my mind now. One, first, when we talk about eradication, we must go through another step known as elimination.
Yeah.
And before elimination is the control. Many countries in Africa are in the control stage, and they are just struggling to really reach the elimination stage. And in elimination, the kind of strategies and tools could change. And this need to be, we need to have a foresight for them. We need to innovate for them. And it's only when you have elimination in various areas that then you start talking of eradication, because eradication means no malaria across the globe.
Ever.
Elimination is geographical.
A really important difference between that elimination and eradication. And you're right in terms of making sure that that's broken down.
Yes, and I think it's important that there are lessons learned at each step and what can be done better. And from where I sit, I think a country like Kenya, which has a very diverse epidemiology, there are regions with very high, others are very low. I am happy now among the strategies is to look at those areas with a low burden and earmark them for elimination. And as you eliminate it in bigger geographies, then concentrate your efforts now in the areas with a high burden.
In terms of when you were just speaking then, you said, why not? Why not Kenya? Why not sub-Saharan Africa? So why not?
Why not? Yet we suffer the highest burden.
Yeah.
And that question of why not is usually the political high leadership that ask, what are we not doing right? And we've always told them part of the reason is just the geography and the ecology, the land use here, the type of malaria vectors that we have, the climatic conditions that we do have. But we've always also emphasized, if we really have to have an impact, then we must have resources. We must have the funds, the money. And I personally refer them to a publication that has always shown in Zanzibar and in Cape Verde. They have been able to eliminate malaria more than 3 or 4 times. And when they thought they have eliminated, it comes up again. But there's a very strong correlation with a reduced funding. When you have less money, the malaria starts coming. So the whole issue is therefore the funding availability in African countries to sustain the gains that we all celebrate once the support from the international community comes.
So Dr. Akhwale, on that note, because we have seen a reduction in deaths globally, especially since the initiatives with Rollback Malaria Partnership to End Malaria, the Global Fund, what can we do to accelerate these efforts now?
Yeah, so for me, where I sit, a number of things, and one of them, in the role that you introduced me, I'm a senior advisor to the President Uhuru Kenyatta, President of the Republic of Kenya, who is currently the chairman of the African Leaders Malaria Alliance. And among his legacy agenda is the whole issue of domestic funding, ensuring that we complement the support, involve the private sector, look for innovative ways of raising resources that will ensure that those interventions reach the people. Another innovation that he's really advocated as part of his legacy agenda is to do with digitalization, ensuring the data is available, and that this data is used for decision-making at the community level. That we tell them, they themselves can see the number of cases. Then they ask themselves, where are these cases coming from? And through their own initiative, they may find it's a breeding ground very close to their homesteads. And then they put preventive measures that will ensure that mosquitoes don't breed there. People are using bed nets and they get treated. So I think those local solutions at the community level and the involvement with an eye on how that could be sustained, even as funding reduction occurs, is, I think, what would be an answer to the question you've asked.
So on that note, my final question for you, Dr. Akhwale, is what are you excited about that you have upcoming in the fight against malaria?
My excitement is that I've lived the full course. I have been a student. I have been a young researcher. I have been a program manager. I am now an advisor to the leaders of the African continent on malaria. And really what excites me most is that malaria has somehow got its rightful place as a top socio-political agenda. It is very clear among the African leaders that they must place malaria as a top priority, that they must advocate, and that it is shameful that in the 21st century we could be losing over 500,000 lives to a disease that can be prevented, yet we have the tools that can prevent it.
Yeah, I think that's a really powerful and inspirational note to finish on. I think one of the phrases we often hear is, this is preventable and it's treatable.
Yes.
Thank you.
It's so absolutely much. Preventable, it's treatable, and always to remember that a number of countries are now eliminating malaria. So many others can do the same.
Yeah, I really like how you put that. that actually other countries are eliminating, we can do the same. All countries can do the same. And it's that step around elimination to that eradication.
Mm-hmm.
Thank you so much, Dr. Akhwale, for everything you shared with us today, your brilliant research and your contribution towards this crucial fight. It's been really great speaking with you today. Thank you so much.
Thank you. Thank you. It was my pleasure, and I hope my story will inspire other people. We want more African scientists. We want new leaders. We want the youth to take this challenge and ensure that even as some of us exit the stage, there are more enthusiastic people to drive this agenda a lot more than what we may have done, so that we have a good story of how we actually eliminated malaria from the African continent.
Yeah, absolutely. The youth are so incredibly important. Thank you so much, Dr. Akhwale. There's a really strong message. And thank you all for watching our episode of the Impact series. We really hope today's conversation has provided important insight and can prompt key and impactful conversations. I think it's really inspiring to hear from the likes of Dr. Akhwale. You'll be able to follow the Impact series right here on the Vestergaard website. So do keep an eye out for the next episode as well as part of the Impact series, where we'll have the opportunity to speak with another great guest on this incredibly important topic. Take care. Thanks again for watching, and see you all next time.